Hello and welcome all of you. This is Rajesh Trivedi from Alert, the managing trustee at Alert, and good to meet you through this wonderful episode that we have all been looking forward to as part of Alertathon and also on the occasion of the World First Aid Day. And as you all know, Alert is an NGO that is working towards a better emergency care ecosystem and steadily marching towards the goals set for it by the former President of India, Dr. APJ Abdul Kalam, to train at least one in every family in emergency care. And working towards a better emergency care ecosystem, Alert is always in an endeavor to learn and learn what's happening around the world when it comes to saving lives, and specifically through the emergency management systems, the efficiencies, and things that we can learn and pick from and see how we can do it better in our country. So today I'm so glad to be having with us a set of panel members, very distinguished panel members from across the globe, joining us to throw us some light and give us some global perspectives when it comes to handling emergencies and how to save lives and the systems and the community involvement, so on and so forth. So it's my pleasure to introduce the distinguished panelists to my audience today. So let me start off with introducing Dr. Prakash Tirupati. He's an MD, is a gynecology and fertility specialist in Columbus, Georgia, and has over 27 years of experience in the medical field. He graduated from Ohio State University College of Medicine Medical School in 1993. Dr. Prakash has won several accolades in the recent past, one of them being the Fellow American Congress of Obstetricians and Gynecologists. Welcome, Dr. Prakash, to this panel. I also have with us today Dr. Mallika Thirupathi, MD in a geriatric medicine specialist in Columbus, Georgia, and has over 22 years of experience in the medical field. She graduated from JJM Med College, Mysore University Medical School in 1998. Dr. Malli is from Coimbatore originally, and her father, Dr. Natarajan, now retired, was a very sought after neurosurgeon in Coimbatore. Welcome, Dr. Mallika, to this panel discussion. And I have with us today, one of our own advisors, the member of the board of advisors at Alert, to be moderating this entire panel discussion. And Dr. Anand Kumar joining us to moderate this panel. Dr. Anand is the founding CEO of Bugworks, a US and India-based company solving global antibiotic crisis using novel techniques to design next-generation antibiotics. Anand is from Chennai, who moved to US to complete his MD and PhD in the George Washington University. After a long stint in US with leading organizations in the semiconductor and electronic design automation domain, he moved back to India with his family. So, my dear friends, it's a wonderful panel that is going to discuss some of the global perspectives in this space for all of us to engage and learn from. And I'm going to hand this off. The pleasure is mine to hand this off to Dr. Anand Kumar to moderate this discussion and take it forward. So, EMS, a global perspective for all of us. Dr. Anand.
Thank you so much, Rajesh, and it's an absolute privilege and honor to be part of this very important panel. And I thank Dr. Mallika and Prakash for making time in their busy schedules. All of us have the greatest admiration and respect for doctors who are working in these very difficult times. So thank you for what you do, and thank you for being here. Small clarification to your wonderful backgrounder. Rajesh, I'm not an MD, PhD. I don't have an MD. I wish I did, but I don't. But great honor to be here. It's been a real privilege for me to be part of the Alert journey since day one. And for the audience who are seeing it here, it's just fantastic that we're able to have the World First Aid Day panel. There's going to be a 6th edition of Alertathon. And this panel is going to be as part of the backdrop of this Alertathon. And we all congratulate Rajesh, Kala, and the entire Alert team for pulling it off together. I hope more people register for this event and make it a fantastic success. Okay. Dr. Mallika and Dr. Prakash, actually the emergency medical system in the US is very special to me because let me start with the personal anecdote. My father clinically died of a cardiac arrest in 1996 when I used to live and work in the Bay Area. And we called 911. They were home in 3 minutes. Yeah, and he was a doctor. The doctor had he had flatlined, and they defibbed him, and then he was taken to the hospital and resuscitated, and came out and lived for 18 years post that before he passed away. So I have the greatest admiration for your systems. And what I would like to do today is not really to compare the US and India, because we can't. US spends 18% of GDP on health. India spends 1.2%. So we are not even in the same scale. But you all are living, you're breathing, you're part of that ecosystem. And if there are some best practices that we can take and adapt/adopt to the local context, that's what we want to get. And the three pillars of our discussion, every interaction of ours, we would hope will fall in three pillars. One would be in the actual delivery, how the whole EMS has impacted delivery. One will be in policy, that is bringing all of these players together and the ecosystem together to enable and foster EMS in the US. And the third is education and awareness. So one of these three pillars. And then we'll finally bring it back to maybe a couple of suggestions that we can give to Alert, because Alert is playing a very important role in India. India is a country that is very poorly prepared for emergency response. That thought process is not there. And in that difficult environment, Alert is doing something so transformational. 1.5 lakh people trained, many more trained through multiplier effect. So whatever we can suggest to help Alert become an enabler to work with local governments and central government, that would be a fantastic takeaway from this panel. And we would have served this panel and the many audiences that could potentially benefit from it. First question to you, Dr. Malli. When one looks at the US and emergency preparedness, it looks like it's a whole network that comes together. School children seem to be prepared. University, you walk into a university cafeteria, we find a defibrillator in the canteen. You go to a mall, you go to the airports, everywhere there seems to be a preparedness. There are drills, etc. What are your thoughts? How did this all come together and become part of the very fabric? Would love to hear your thoughts on that.
Thank you, Anand and Rajesh, for the kind introduction and including me in this panel. You brought up a very, very good point of how the community comes together to bring it and to save lives. I'm going to start with the school level. Let's say the elementary school level, which is of kindergarten to the fifth graders. What they start out first is like a show and tell. There's firemen who come and just give the kids thoughts on what they do. The little kids are sponges. They just soak in everything. And when it's given to them as a fire truck and the firemen and what they do, it sticks in their mind. So does the police. And so does the EMS, the servicemen. And that's pretty much a few times throughout their elementary school years. And it's not the technical aspects of it, but they understand how important those services are to their family, to them, and it is okay to reach out to them. High school, middle school, it's not as common as this, but they're all given different platforms to learn from. Mostly those are like the Red Cross or the other volunteer organizations. They have classes, and the middle school and the high school children, most of the time, volunteer time, it's actually mandated part of the schooling. So they will try to learn these things, implement it, and get to know more about it. The other thing too is every place, the school, the university, the college, identifies a nurse or a clinical person. So if something happens at school, we reach out to this nurse. If something happens in the college, there's a clinic, we reach out. So they identify a leader. The other thing too, some of the teachers, coaches, athletes are mandated here to have the CPR and the BLS training before they can apply for a job. Yes, you had a point about the defibrillator, because it is proven to save lives within that matter of first few minutes. And it's got to be accessible. And it's in all public places, like the malls, the shopping areas, public transport, schools, colleges. And you identify the leader who can use it, or you go to. And we have our 911 services as well. At home, sometimes they have like those alert buttons, which actually the elderly, they can use to call 911. They fall, they have a problem, they can call them. So those options are available to everybody in all settings.
Excellent, excellent. Rajesh, a key point, I mean, she mentioned multiple key points, Dr. Mallika, is mandating people to have this skill for a job application. That's how I think we have to bring it at a structural level, right? Great inputs. I also want to welcome Dr. Shankar, who's taken time from his really busy schedule that we can visually see. Hi, Dr. Shankar. This is Anand.
All right, sorry I'm late, guys.
No problem. Rajesh, would
I'll
you
try to
like to?
contribute what I can.
I'm sure you will. Rajesh, would you like to do a quick introduction of Dr. Shankar, or we can come back to that later? How would you like to do it?
I'll just jump in where you guys.
Sure.
I'll try to jump in.
No problem. Thank you very much, Dr. Shankar, and thank you, Dr. Mallika, for those comments. Moving to you, Dr. Prakash.
Sure.
You know, it's incredible, as we said, if you look at the whole value chain, you have people who are aware of EMS, and then you have this phenomenal system, which is the best in the world, called 911. And then you have these heavily equipped ambulances that come along with the fire person, along with police if required. I just want to understand from you, from a doctor's viewpoint, what does this mean to clinical outcomes? This is very important to understand. The reason I ask this question is emergency medicine is not a sought after discipline in India. And I'll come to that question later. It's unfortunate it's not. So my question has two parts to it. How is emergency medicine as a discipline within the medical fraternity viewed? And how does this whole handshake between common man understanding emergency to the EMS services to clinical outcomes play? To you, sir.
I just want to thank you for inviting me. This is an honor to be a part of the World Health Aid, and thank you, Kala and Rajesh, for doing this. It's a wonderful thing, and I appreciate it, and I appreciate the invite. I think from the EMS perspective, India definitely needs to be better than it is right now. I mean, we have the smartest people. We have the most technologically advanced society. I mean, from a brain perspective, it's all there in India, and we still have a problem. It shouldn't be. And I think we have to bring together everything, like you said, from EMS to doctors to education, everything. I think Mallika did a wonderful job explaining, the educational side of this, because that has to be key in the structure. I think when we talk about the successive implementation of EMS, we know that it has to be rapid. It has to be rapid because the clinical outcomes depends on how fast we can get the patients to the hospital, right? So they don't bleed out on the way because they waited too long, or the heart attack, the heart is dying faster, So the time is a critical factor, and for that, there has to be a very streamlined system, I think. There has to be a very structured system where things happen rapidly, already planned to happen. A call goes to an agency, and that agency will do. That's how it works here, and it doesn't seem to be. And I know that you all been working on it there as well, trying to set this up in a state-by-state thing. But I think a more structured plan, because it is a critical thing, and we have to start out, with, I think, an agency that's responsible for something like this, not just a random thing, but whether that be governmental or public or a private institution. But I think there has to be one, and Alert can play that role, where I think it can be the starting agency that sets up the fabric of the structure of how this is going to work, and then take it to a place much higher than in a local level, that we can say, okay, this is how it's going to be implemented for every situation. One phone call comes, not just for fire or police, but one system where somebody there can triage where the call needs to go, and who needs to be called, and implement that. I think that's the structure of this whole thing is going to be important for the program to succeed in order to get a good clinical outcome in the end. Okay, So I think, that's where a lot of the focus, because I think Alert has done such a phenomenal job in training and getting people educated in this. They did a phenomenal thing. I've watched it over the years, and, through trials and tribulations, Kala and Rajesh managed to, hold this thing together and grow it, and getting corporations involved, and, funding and all that. Funding is obviously central to this structure, right? Somebody has to pay for all this structure. So where's that money going to come from in the future? Those are talks for futuristic, I think we can get into, but a structure is important for clinical outcomes to be successful, in my opinion, and streamlined, and an agency responsible for doing this. You can't have agencies that don't talk to each other. It has to be one agency that spreads it out and delegates where people need to go, in my opinion.
Fantastic. Rajesh, he almost gave a 15,000 feet blueprint of that structural role that Alert could play in terms of stitching together this ecosystem. Thank you so much, Dr. Prakash. Dr. Shankar, sorry to put you on the spot, but it's just great that you could join us. I'd like for you to tell our viewers what the faculty or the discipline of emergency medicine means. And I'll tell you why I asked this question. It's a loaded question. I just did some survey, and I figured out that the Medical Council of India, the MCI body, has still not yet given a special status to emergency medicine. And we don't have enough seats. And if you walk into a casualty in India, you don't have a trained ER person or emergency medical person. I'd like for you to share with our audiences, how is emergency medicine, trauma, that whole area viewed as in the US? Is it a tough residency to get in? Is it just an afterthought like it's in some parts of India? Walk us through what it means and how does that influence outcomes in your observation?
I think the emergency medicine is a dedicated residency program that they have here just like for cardiology, for surgery, for OBGYN. This is a separate track that the medical student has to decide, this is what I want to do, and pursue that. So it's a whole different line of training that these residents would go through rather than, an internal medicine doctor would, because they take over the care after the patient is stabilized. So, in this country, culturally, with all these TV shows, ER and all these, they make it fairly glamorous. Like this is a very glamorous job to do. These residents see all kinds of illnesses, emergencies, and so it's highly known about in public, and what the public views as a physician is usually what they see on TV, is these emergency, medical shows that come on TV, which are done by the role of the emergency room doctor.
Okay. Sorry, I was just going to quick, because you made something very interesting there. Is that true even in primary healthcare settings or only the larger tertiary hospitals?
Even in the primary care settings, the ER facility is manned by a emergency trained doctor.
Wow.
And unless you get into the very rural communities, then any doctor would fill that role. But any medium, even small-sized city with a reasonable hospital will have an emergency trained physician there.
That's fantastic. That's a big learning for us, Rajesh, and everyone else here, right? As we, Alert can take the role of working with the MCI, etc. In the US, when you even walk to a semi-rural hospital, you pretty much get the same level of treatment. There's the protocols, emergency protocols, having lived there and witnessed it. It's incredible. So he's so right. It's across many layers. Dr. Shankar, can we come back to you with a question later, or are you time bound? In which case, I may ask you one more question if you want to leave.
Go ahead and ask. They're going to come get me when they need me.
Okay, Dr. Mallika and Dr. Prakash, if you'll allow me, I'll just ask Dr. Shankar because he seems to be on
go ahead.
The other things. And Dr. Shankar, how does, in your opinion, what are the best aspects of the 911 system that you would like to see a country like India adopt? Like I said in the top of the panel, we are not the same as the US. We don't have the funding resources as you guys. But if there were a couple key aspects of the 911 system that we could use here in our delivery of emergency services, what would that be?
I was looking into this in preparation for this conference, and you know, at least in this country, the 911 system did not come into being until in the late 60s. And then it took about 20 years, even after that, in the 1980s is when it really became adopted in this country, you know, where multiple states were doing it. I think that, like Prakash was saying earlier, the beauty of this system is the centralized dispatcher. So all calls are routed to one local dispatcher. So the 911 is local to every community. Right? It's not a federally funded program. Each city, county, they're responsible to pay for this and have it running. So all calls are routed to one central location, and that dispatcher will have the will need to distribute the call to the proper place, whether it be an ambulance, whether it be EMTs, emergency medical technicians, or paramedics. You know, depending on what they are getting the call as, whether it be fire, whether it be police. So that dispatcher makes the call who to send out there. Okay, so all these other ambulance services, which nowadays are very insurance dependent and money oriented a lot of times, have contracts with the city to provide service for a certain location. You know, so, you know, the problem with calling an ambulance is very expensive. You know, one ambulance call to take to the hospital is going to easily be $2,000. You know, and usually if they have insurance, that picks up the cost, a portion of it. But there is a portion that goes unpaid, and either the patient is responsible for it, or you know, sometimes the local government has a special program that can fill in the gaps here and there. So unfortunately, it's a money-making business too, these ambulance services.
Sure.
But I think that's the nature of medicine these days here.
I appreciate that. By the way, India has a system that was announced last November. Rajesh knows this really well, 112, where you can call that number and will integrate. I made a call just before this meeting. Unfortunately, it didn't go through. But 108 does a pretty decent job. So we are slowly coming up to speed. One generation behind, but like many other areas, India will catch up. Thank you for those comments, Dr. Shankar. And that segues into a question I had for you, Dr. Mallika, is why are people not afraid in the US to help others in a case of emergency? Is it because they're always taught that the legal system will protect you, or is just innately altruistic societies? So that's one half of the question in terms of the legality. I also want to understand your thought processes on the role of insurance in being an enabler in EMS.
Why are people not afraid to help each other is, I think they know what to do. You know, it's that knowledge. It's the knowledge that they are given, they learn, they look, and they soak it in, and they know what to do. Okay, hey, I see somebody fallen. I'm going to call 911. Simple. Everybody gets to do that. There are laws that protect, the Good Samaritan laws that will protect to some extent. I'm not going to say it's 100% of foolproof. There are situations where, you know, you're legally mostly okay doing what you do. So I think that's part of it, is the knowledge of what you need to do. Just having a streamlined, like Prakash and Shankar both said, a good system that will work for everyone is probably what it is.
Beautiful. Thank you so much. And Rajesh and Kala and team have done a great job actually in India trying to foster this Good Samaritan rule. Alert has actually played a role. To the viewers here, Alert has played a role in trying to bring the Good Samaritan Act, which was passed in some states. Of course, implementation, as you mentioned, Dr. Mallika, may not be perfect, and it takes a hard time to implement in India, but it's starting to happen. So it's good to see the basic edifice starting to form for this. Thank you very much.
What Mallika was saying is, everybody is conditioned here. If something they see wrong, even if somebody falls or somebody's walking with a gun and somebody's outside the house, they're conditioned to automatically call 911.
That's right.
Yes.
See, that conditioning is what prevents problems, long-term problems, and good outcomes happen because of that, because they are conditioned to call. You ask anybody in any demographics, rich, poor, a 5-year-old kid, you ask them, who do you call when there's trouble? They'll say 911. Even a little kid will say that. So that condition is the key. And for that, you have to have infrastructure. You have to have infrastructure.
And Dr. Prakash, just continuing on with the line of questions for you is, insurance is not perfect in the US, we know it. Particularly the healthcare insurance, despite spending 18% of GDP, the outcomes are not in the top 10 in the world. We know that. But what are the good things that you have seen? How does the whole insurance mechanism enable a delivery of emergency? Is everyone somehow covered for emergency, whether I'm properly insured or not? I just would like our audience to understand how that works.
Insurance companies are in the business of trying to save as much money as possible, okay? So, but at the same time, if somebody goes to the emergency room and they're denied care, then the lawyers get involved and they say, you denied care, we're going to have a lawsuit. So, there's a double-edged sword here. So the emergency, the hospitals, the insurance companies have to take all that into consideration. It's a legal thing when it comes to human rights as well. You have to bring human rights into this as well, because when somebody comes to the emergency room with they're bleeding out, you have to treat them. You have to give them human care, and whether insurance covers or not, it's up to the insurance companies. So, it's a difficult situation here. The hospitals have to care for this patient, knowing that they may have to not get any money for it, use their supplies and their manpower to save a life, but get nothing in return. And even if you have insurance coverage, you're going to have certain amounts that are not covered. I mean, you have to understand insurance is the premise of them is to save as much money as possible, in my opinion, avoid paying. If they can avoid paying. So it's just that's just what we live with here.
Sure, but basically, whether it's sorry, go ahead. Please go ahead, Dr. Mallika.
I'm sorry, I didn't complete that.
Sorry,
so we
please
also
go
have
ahead.
several patients without insurance who also get in trouble. So there are several, instances that the hospitals have where the city funds, or they call it write it off, where they can treat these patients and not charge. I mean, they lose money on it. Then the other social welfare systems like the Medicare and Medicaid, they're mostly for the elderly, also will come into play and try to cover at least 90% of the cost. But there's several catches to it if it has to be medically deemed as necessary.
Excellent. Okay.
So a lot of it, which is not covered by insurance, the city and the government do provide some funding.
They do.
So
yes,
they do.
That's very interesting. Thank you very much for those inputs. Dr. Shankar, so do you all hear in terms of public policy dialogue and debates that are people actually willing to pay part of their taxes towards that local support systems that are required? Because we have never understood how that, I mean, the money trade is always very complex in these discussions, but as a doctor
I don't think people,
please go ahead.
Sorry, I don't think people know that they're paying the taxes. It's taken out,
Yeah, we have no choice.
Oh, you have no choice. Maybe that's a situation we need to. Please go ahead, Dr. Shankar.
I think 911 is funded by the phone company. So your phone service, you get a monthly. I think it's $1 to $2 per month on your phone bill. That is 911 charge. So that the money goes that way to fund the center, and I think the local government picks up some of the rest of the tab. None of this is federally funded. This is all on a local level.
Oh, local. Wow, that's really interesting to know. So, Rajesh, when Alert gets a chance to talk to Niti Aayog or any of these ministries that are looking at it, these are good best practices, that this funding happens at such a localized level. When they're worried about it having to be central, going down, it's a mess. So it looks like all of their funding is coming from paychecks and from tax allocations happening at the localized level. That's actually it's a revelation for me. Since we're getting out to the business end of our panel, I'm going to do a round robin and ask each one of you if there were two key points that you would like to suggest to Alert, who are really doing an outstanding job championing this cause in India, a society that's not geared up for emergency, but is slowly getting to understand the importance of emergency thanks to Alert. What would those two pieces of advice be? And this is not just for Rajesh or Kala. This is actually good advices that they can take with them and actually when they deal with the local authorities or New Delhi, they can actually use these inputs. And that's the whole idea of having such knowledgeable people on the panel. I'll start with you, Dr. Mallika. If there were two pieces of advice / inputs, words of wisdom, what would they be?
I think number one is to have a universal, streamlined protocol for the entire country, where no matter what part of the country you are in, you know what to do. And it's standard for everybody with the same practices. The second would be awareness. Alert should be a household name for what they do, how important they are. Even a single life lost is one too many. And that's what it should be.
Awesome. Thank you so very much. Dr. Prakash.
I think, I think Alert needs to focus. I mean, they've done a wonderful job in training and getting the word out and making people aware there's a problem here, But I think it's, time to maybe go to the next level and try to get an autonomous situation, meaning autonomous funding, where, what happens when this generation is gone? What happens when Kala and Rajesh are, no longer involved? Who's going to take over? Is the funding going to come in from donations? There's a lot of gray. So I think to make it run for generations, it has to be autonomous. And the funding has to be autonomous. The funding is the bottom line. That's what's going to keep things moving, right? You have to have money. So to focus on the level of getting Alert or this EMS emergency system to a governmental level, I think, local level to start with. I think if it can work in this country, it can work there. And I think when one state does it, I think all the other states will follow because it'll be such a nice program. And I think, so that's the first thing. I think Alert should move to the next level of making this autonomous for generation to generation for healthcare emergencies. And the second thing I think Alert should maybe focus also on, once this happens, the second part of it, which is, implementation of the government mandates, making it it's going to be a human rights thing. Hopefully, it can get to that point where you can, sell it as a human rights. This is a emergency safety is a human right,
Yes.
But once the government puts it in their mandate, in their charter, and every successive governmental official comes and takes over, it'll be in their charter. Hey, this is a part of what we do. This is, we have to fund, and how to fund is a different, different discussion. How to fund this, and there's a bit of taxes or sales tax.
Yes.
Here we use sales tax, we use local tax, we have property tax. All the portions go in, like Shankar was saying, our electrical system, Georgia Power, they have, everything goes into funding. So that's important. So the second thing, I think Alert, once this is done, I think implementation, Alert can be so instrumental in implementing this, because, you have to have, the public has to want it, right? They want it. The government has to, mandate it, and then somebody has to implement it. And I think Alert is going to be very instrumental there because they've already done this. And this is just a matter of, now the funds are available. Now, how can we get it to, that would be the structure in my mind for future generations. I mean, I think you need to go to a different level now.
Fantastic. Rajesh, you need to go to a different level. And over to you, Dr. Shankar, for your closing thoughts. And what would those two pieces of key advice be?
I think, funding is probably the the most important pillar here, but almost just as important, I think, is the education, starting young. Letting the grade schoolers, the elementary schoolers know how the process should work, like it is here. Like we said, all the kids know 911 immediately. It should be that way in India too. So there is a means where, you know, when someone's in trouble, even the most basic person knows at least the first step to do.
Excellent.
I think that's the other pillar.
That is fantastic. Yeah. I can't thank all three of you, Dr. Mallika, Dr. Prakash, Dr. Shankar, for taking the time to spend with our audience, with the Alerts platform. Fabulous inputs. In fact, I would like to watch this panel again myself to synthesize these inputs, that it can actually become an application note that Alert could take and take forward. So that's really wonderful. Thank you all very much. And I must tell our audience here that what fascinates me most about what Alert is trying to do is training large number of people and getting them all connected via the mobile phone. I love what Alert is trying to do with voice. So it wants to create a society where when we are sitting in a meeting and if there's an emergency right next door, automatically the app and the GPS systems are able to identify trained volunteers within a particular circumference of where the incident has happened, and someone comes to help. What a phenomenal society that would be anywhere in the world, and more so for a country like India. So admire it. And Rajesh, I wish Alert and the entire team all the very best. Thank you so much for giving me this opportunity to meet these three amazing doctors. We've all learned a lot. And stay safe and healthy, everyone. Thank you so much for your time.
Thank you.
Over to you, Rajesh.
Thank you.
Thank you very much.
Over to you, Rajesh.
Yeah, thank you so very much. It was very, very insightful. And Anand, you rightly said there is a lot that and I really would want to replay every single thing the panel came up with. And there's a lot to take away from. And I want to thank all of you, Dr. Mallika, Dr. Prakash, and Dr. Shankar, for your time, taking your time out and giving us some of very insightful stuff. And it is very clear that there's a lot to do. Of course, yes, we have reached about 140,000 people, and to go after one in every family, we are speaking about 25 crore people as far as India is concerned. And some of the things that you said today is so important for us to reach that scale. And we hope that we work towards that. And probably in future panels, when we come, we will be discussing things little more better than some of the fundamentals that are required in this country. And I'm very glad to also say that the system that is being put together, it is starting to work, the voice system, because as recently as 2-3 days back, we had one of our voices reach out to a person needing CPR, and within 10 minutes reaches there and gives the CPR, and that's rubber.
That's fantastic. Fantastic.
But this is small scale, but it needs to happen at a much larger scale. And a lot of things that you spoke today is highly relevant, and Alert is recommitting itself, taking inputs from all of you from across the globe, and we'll put our best foot forward to see that people in India do not also lose lives because of lack of help. The system. So from Alert, from the Board of Trustees at Alert, thank you so very much for taking your time out. All of you, Dr. Prakash, Dr. Shankar, Dr. Malli, and Dr. Anand, as always, so beautifully weaved. You weaved the whole conversation through so very well, bringing out salient aspects. Thank you so much.
Thank you so much, and all the very best for Alertathon. May it be a fantastic success.
Thank you. Thank you.
Thank you, guys. Bye-bye. Everyone, stay safe. Bye.
Bye-bye.
All these hospitals are there only if these patients can reach. What you are doing is a very noble service. You are able to first, for a person who would otherwise have lost his wife, you kept him alive. So I think the front mark goes to you. So you get the 99, that one person goes to the hospital.